Welcome to Module 4, Costing and Funding. My name is Nathalie van der Malle, and I am a health economist in the Department of Immunization, WHO headquarters. By the end of this module, you should be able to prepare a realistic budget to enable COVID-19 vaccine deployment and vaccination in consideration of existing essential health services. Identify budget inputs and map to budget owners. Part 1. There are key considerations that you can think about when preparing your budget, which will support funds effectively reaching the point of delivery. Budget needs to be based on scenarios, for example, slow or rapid introduction. It needs to be aligned with your National Deployment and Vaccination Plan, the NDVP, as you will iteratively plan and cost until you have a financially sound NDVP. It needs to include a full list of necessary budget inputs, separating health system inputs from immunization-specific inputs, and in as much as possible, seek to identify a clear budget owner or holder by input to understand what ministry or department is responsible for releasing the funds. The Access to COVID-19 Tools Act Accelerator will prepare a more detailed health budget guidance note. Here is an example of inputs needed in the short term and in the medium term, listed as immunization-specific or health system inputs. For example, in the short-term need, a budget input that is specific to immunization is vaccine, and a health system improvement input is supply chain management. Your costing will have been prepared in alignment with the NDVP and will estimate additional financial needs for the planned period. It is helpful to integrate the NDVP budget with your government's annual budget preparations, which typically take between 24 and 36 months. The budget will include immediate and short-term needs, remembering that investments will need to sustain into longer time periods. Budget preparation best be coordinated with existing health system delivery budgets, such as supply chain, facilities, health workers, data systems, to ID existing funded costs. An NDVP costing tool is available on WHO website, and you can see the link at the bottom of the slide, which will help cost different delivery strategies. Examples of cost categories. Here is a non-exhaustive list of cost categories, from human resources to demand generation and communication. Map costing needs versus resources secured. A plan will be successfully implemented if it is realistically budgeted and resources are mapped before starting to introduce the vaccine. The funding of the plan should thus be discussed with the Ministry of Health, Ministry of Finance, and partners such as the World Bank or regional development banks. COVID-19 vaccine deployment creates opportunities to identify process improvements. Some bottlenecks to a successful immunization lay outside of the immunization program, and this is particularly true to financing bottlenecks. While there may not be directly actionable solutions, any opportunities to identify and flag them to the authorities in charge will make a difference in the medium term. For example, bottlenecks linked to public finance management, PFM, can lead to untimely access to resources by providers or inflexible use of resources by providers, preventing them from being able to respond to needs. The latter is often caused by government's budget structure, when it is organized by inputs rather than output-based. Key messages. Resources and costs should be core to the effort to deploy and use COVID-19 vaccines, estimated within available general government and Ministry of Health resources, be it domestic or externally funded. Integrated with the general government response and reflected in budgets. Additional to existing budgets, not replacing them. Focused on short-term needs specific to COVID-19 vaccination and minimize fragmentation. Leverage COVID-19 national coordination mechanisms. To wrap up, the 4 key steps for budgeting the NDVP is first to identify the budget owners for the inputs that you need to budget. 2, to prepare the costing of the NDVP. 3, comparing the costing to available resources until there is a realistic budgeting for the NDVP. And finally, identify process improvements for the longer term. The COVID-19 Vaccine Introduction and Deployment Costing Tool, CIVIC, can help countries prepare budgets for COVID-19 vaccine introduction and engage in resource mobilization, including the World Bank's COVID-19 Fast Track Loan Facility. The costing tool is available at the website copied on this slide. Thank you for your attention.